More than 1 in 10 Americans experiences some degree of hearing loss, and that number increases with age. Dr. Sarah Schwertner from Primary Care Plus joins us now to discuss how to protect your hearing. Good morning to you.
Good morning.
You don't think about it until it starts to go, I guess.
Right, right.
So I was surprised in terms of the incidence. It's half the people who are over the age of 75?
Yeah, so 1 in 3, 65 and older, and 1 in 2, 75 and older, have some form of hearing loss.
Talk me through, in layman's terms, what happens to your ear when you start to lose your hearing?
So when you start to lose your hearing, the auditory nerve can actually become damaged, and this can be caused from loud noises, just aging through the years and different things you're exposed to.
If you go to I've heard, I don't know if it's true, but I have heard if you go to a concert or you're near a jet engine or whatever, and you have an instance of, you know, some really loud hearing experience, that your hearing never really totally recovers?
Right, so just one loud blast can damage your hearing. So, you know, you have to be really careful when you know you're going to be around loud noises.
It was that Stones concert in '82. What are the signs?
So some of the signs of hearing loss is having trouble hearing on the phone, having trouble hearing people talk whenever there's background noise, thinking that people are mumbling around you, having to listen to the TV a little bit louder than everyone else thinks is the normal amount of volume.
You know, if you take a radio, you learn this early in this business, if you take a microphone, a radio microphone, you stick it out in the open air, it'll pick up all kinds of noise if you're farther away from the person speaking. Our brains and our ears process that in a way that you kind of block out the noise. But when you start to lose your hearing, you can't do that as well?
Right, so you start losing the high frequency or high pitched hearing first, and then some people, you know, they'll have to tell their loved ones, like, I think you need to get your hearing checked. So if you're having some of those signs, you should probably speak to your doctor about when to get checked.
Genetic?
Genetic does play a role, so sometimes the shape of your ear, the way you're born, you're more likely to have hearing loss at an earlier age.
The shape of your ear?
Mm-hmm, the structures inside of your ear, the shape of the structures inside of your ear can have a genetic component, and you can lose your hearing at an earlier age.
Preventable? I mean, obviously, if you can harm your hearing, you can prevent it, but what do you do to prevent it from happening?
So ear protection, if you know you're going to be around loud noises, if you know you're going to go out shooting a gun, things like that, wear ear protection. Try not to listen to music so loud. I know a lot of those teenagers have their little ear pods in, blasting the music. Later in life, they're going to lose their hearing at a younger age, things like that. And
there's a lot of that out there too now. So you just, you know, I know that it's tough to get people to get out of those habits with their phone and everything, but it makes a difference. How is it treated?
So you really can't repair hearing loss yet. Maybe in the future they may be able to, but you can get hearing aids or cochlear implants, and those things can actually help you hear better.
All right, Dr. Sarah Schwertner from Primary Care Plus.
Thank you.
Thank you very much.